All right, guys. Welcome to the Scope at Night podcast. It is 5 o'clock, so we are going to go ahead and get started. Tonight, I am your host, Paul Hackbarth, with the Phelps Health Marketing and Public Relations Department. So, like I said, welcome to a special edition of the Scope at Night podcast. I'll be your host. Before we get started, I just want to touch on a couple of housekeeping items. That's a hard word to say. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating this session with my Phelps Health marketing colleague, Hillary McCash, so one of us will be sure to help you if you need it. Also, we would love to see everyone's faces. I would love to see mine too, except I'm having some camera issues tonight, but if you feel comfortable, turn your camera on. It makes more fun and interactive sessions. So please note that each of you are currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box, and we'll try to get that question answered for you. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions or comments to the whole group, or you can just send it to one person. We'd encourage you to send your question or questions and comments to the whole group so that everyone can participate in the discussion. However, if you are, and also you are welcome to send a private question or comment if you feel more comfortable doing that as well. We also want to encourage everyone to utilize the reactions that Zoom offers during this discussion today. You can use the hand clap, thumbs up, thumbs down, to let us know if you like, love, agree, or disagree with whatever we're discussing. Reactions are in two places, one either on the top or bottom of your screen, and one you will see when you display the participant list. Also, if you're watching us from Facebook live stream, first of all, hello. And second of all, feel free to ask questions, comments, or show us emoticons during our conversation tonight. We will be conducting a poll through this Zoom meeting at the end of the session, so you'll get a chance to interact then if you choose. And as I mentioned earlier, the chat feature, we encourage you to use that as well. Some of you may be using a mobile device, while others are using a laptop or computer. If you find that your features just aren't the same, we just ask that you participate with us however you can. And if you're having issues with sound or any other features of the Zoom meeting, please use the chat box, and one of our moderators will be happy to assist. Before we begin tonight, I'm going to introduce tonight's expert. His name is Dr. Cory Offutt. He's a family medicine physician here at Phelps Health. Welcome to the show.
Thanks for having me.
Yeah. So today we're going to be talking with Dr. Offutt about some common skin conditions, skin lesions, things like that. So let's go ahead and we'll just jump right in. All right, so question one, Dr. Offutt, what is the purpose of our skin, and why is our skin so important?
So our skin is the largest organ of your body, and it's actually your primary first-line defense against pretty much everything. It's your primary insulating aspect of your body as well, so it maintains your temperature, protects against other infections, and just even physical barriers of harm as well. So it really has a multi-function approach, and it's our main protection against everything initially.
Awesome. Yeah. So it sounds like it's really important. Like you said, it's our largest organ, and yeah. So on to our next question. So I've always heard there are different layers of skin. Can you kind of break down what are the different layers of skin we have?
So there's the epidermis, which is the top layer. That's the initial protective barrier. That's where most of the new skin cells are being made. It also provides like all of your pigment cells and things like that. Then there's the dermis, which is the middle layer. That's where all of your hair follicles are actually located that then grow up through the top of the skin. And there's also a lot of connective tissue and collagen layer in this as well. That's predominantly providing all of your structure for your skin. And then there's the hypodermis, which is the fatty layer that's underneath. And that's just before you get to like your muscles and your bones. And other connective tissues, nerves, blood vessels, and things like that. And that's predominantly what the layer that regulates your body temperature.
Okay, that's very interesting. Yeah, you only think about the part you see, the epidermis, but there's layers underneath that as well. So.
Yep, definitely.
Okay. All right. Right on to question 3. So, Dr. Offutt, can you tell us how are skin conditions diagnosed usually?
So there's so many different types of skin conditions, and it depends on if you're talking about like individual lesions versus rashes versus any number of things. And so usually those are diagnosed in a clinical setting at a primary care provider's office. Sometimes we can even do them via telemedicine video visits, depending on how big it is of the area that we're looking at. Such things like poison ivy, hives, things like that are pretty easily diagnosed. And then different rashes, sometimes we actually have to feel the rash because it'll have a different texture, or if it's like a very fine rash that it doesn't really show up well on video, then we would have to really see it in person. Sometimes you can make a diagnosis off of looking at something in the history alone. But other times there are times where we have to do either skin scrapings, biopsies, shave biopsies, things like that to determine what's going on exactly.
Okay, that sounds great. So you kind of mentioned just maybe like looking at over a video. I know Phelps Health does offer like telehealth visits and things like that. So if maybe I had a skin condition, could I do a video visit for that with my provider? Or?
It is possible. It varies by provider as well. And then it also, like I said, it depends on the condition that's going on. Some things are very straightforward and to the point, like poison ivy, for instance. Like most people that get poison ivy know that they can get poison ivy. And so they'll know whenever they have it. And so a lot of times most providers would do a video visit on that just fine. That way you don't have to necessarily come into the office in person.
Okay, so that's great information to share. Thanks. So. All right, on to question 4. You kind of touched on this, kind of what skin lesions are, but what are the different types of skin lesions?
So that's kind of a very open-ended question because there's so many different types. I couldn't even begin to name all of them. But there's both benign lesions, which are non-cancerous, and then also malignant lesions, which are cancerous. And then there's a wide spectrum within each of those. So there's like benign moles, freckles. I mean, you name it. They're like that, or solar lentigines, regular lentigines. There's warts. There's hives, like all sorts of stuff. And then there's your pre-malignant lesions as well that are precancerous that are likely to turn into cancer, that you want to get addressed before they turn into cancer, ideally. Those things are like actinic keratoses, which are super common. They're most common on sun-exposed areas, particularly on the face, the top of the ears, scalp if there's not much hair coverage. And then the left arm is actually more common than the right arm because of it being out the car window if you're the primary driver. Just for things like that. And then your cancerous lesions, there's basal cell cancers, squamous cell cancers, melanoma. And then those are the 3 more common ones. And there's some that are kind of more rare that are in between all those.
Okay, so that's really interesting. Yeah, I didn't think about the left arm that being more common. So, but,
and then all of those lesions are all can be described individually based on what they look like, if they're raised or not raised, and things like that.
Gotcha. Okay. So, well, you were talking about in some cases, some of these skin lesions can be cancerous. So that's a great segue into our next question here. What is skin cancer and what causes this disease? And then what is melanoma? Because sometimes I hear that as synonymous as skin cancer, but is that really the case?
So melanoma is just a specific type of skin cancer, and it's probably one of the most aggressive forms of skin cancer. And I'll get to that part in a second, but like cancer in general, and this goes for any cancer, not just skin cancer, is a dysfunction in the ability of the body's, dysfunction in the body's ability to take care of abnormal cells. And so something went wrong in the hardwiring of those particular cells, and they were able, because normally our body will basically attack and destroy anything that's abnormal, that's not dividing normally. But then those particular cells have developed a mutation of some kind that prevents your body from destroying it. And so then it's able to divide over and over and over again and continue to thrive without your body actually being able to take care of it on its own. And so then it turns into a larger cancer. And so that's predominantly how all cancers form. Some of that can be genetic, and some of it's just spontaneous mutations in the cell machinery that doesn't allow your body to take care of what it's supposed to do.
Okay. So,
And then as
you
far
said
as
melanoma.
and then the melanoma is a very specific type of skin cancer that is, I wouldn't say it's the most common, but it's one of the most aggressive and probably most recognized, because they're your typical like really dark black kind of skin lesions, very irregular. And we'll get to kind of how to tell the difference between the concerning and not concerning lesion here in just a minute. But melanoma is probably the more invasive forms that everybody worries about, but then there's other forms too that are actually more common than melanoma even.
Okay. Yeah, I was going to ask that if melanoma was the most common, because I think that's probably the one you hear most about. But there are other types. So okay. So, all righty. Well, great answers to that. Great answers to those questions. So again, along these lines, I think we're out this is summer now. We're kind of outside more. Maybe going to the rivers or creeks or beaches and whatever you may call it. And so when you do see maybe a little discoloration on your skin, or and they go by different names. There's moles, there's freckles, sunspots, age spots. Can you kind of tell us what is the difference among all these types of skin lesions?
So sunspots and age spots are essentially synonymous. They're solar lentigines, and those just, like it says, like they allude to, come with like age and exposure to sun. Because the older you get, the more sun you've been exposed to. Freckles are an inborn thing, like you're born with them, and it's usually more genetic related. Freckles generally will not turn into cancers, but people with more freckles may be at higher risk of developing skin cancers because people with more freckles tend to be more fair skinned. And then the moles are usually raised, freckles are not. The sunspots and age spots also are generally not raised. And there's a second one or an additional lesion to that I'll get to in a second. But moles generally are raised. Moles can potentially turn into some skin cancers as well, so you do have to keep an eye on them. So anything that's actively changing are the ones that you really need to worry about.
Okay, that's great. So I'm going to interrupt for, we got a question from Facebook, and I hope I can pronounce this right. But they were asked, we got a question that said, is it actinic keratosis?
Actinic keratosis?
Yes, become cancer. Can that become cancer? So.
Actinic keratoses are precancerous lesions, yes. And those are the ones that I was alluding to that are more common, like on the left arm, on the tops of the ears, on the scalp, and areas that have more direct sunlight exposure. Tops of the ears are especially common because that's the one spot that people forget to put sunblock on.
Okay, so, all right, well, good. All right, let's go on to the next question. So you were starting to kind of talk about this. So how can I tell if a mole is cancerous? What are the signs I should look for? You mentioned if it's changing mole, things like that.
So we go by something called the ABCDE on evaluating skin lesions. So you look for asymmetry in the skin lesion. So if you would draw a line right down the middle of it, does one side look like the other? You look at the borders. Are they a nice smooth border all the way around, or is it a very irregular jagged border or a very hazy border? You look at the color. So if it's a very uniform color versus variations in color, that matters. Variations in color are usually more concerning. The diameter, so anything greater than 6 millimeters, is usually more of a concern than anything, especially smaller, unless that smaller lesion is actually actively changing and growing. And then how is the lesion raised or not plays a factor into what type of lesion it could be as well.
Okay. So, all right. So yeah. So remember your ABCs when it comes to that. So. Yep. All righty. So now that we've kind of talked about maybe what causes skin cancer and the types, what are ways in which skin cancer can be prevented?
The number one way is just to avoid and reduce sun exposure and avoid tanning beds and wear sunscreen. I mean, it all comes down to amount of UV exposure. Now, there are some extenuating circumstances such as genetics that play a factor as well, but very much so, like the amount of sunscreen you wear, the level of sunscreen that you wear, which SPF, and then just overall time in the sun, and how much damage you acquire from the sun. So the more times that you're sunburned and things like that, the more at risk that you are.
Okay. You mentioned SPF. I know when you're looking at the store for the different sunscreens, there's different kinds of SPF, different numbers. What are the numbers that maybe we should be looking for on those?
I mean, the higher the SPF, the more protection that you get. And so if you're a more fair skinned person that has a tendency to sunburn easily and things like that, the more direct areas, like what my wife and I do for us and our kids, is basically the more sun exposed areas get higher SPF, and the areas that don't burn as easily get lower SPF. We get anywhere from 50 to 100 SPF for the more direct areas, and then areas that don't get as much sun, that don't tend to burn, we go 25 to 50. Usually we stay 50 and higher for everything, really.
Okay, so that's great information.
And then you also want to look for a specific ingredient in it too. The avobenzone actually will provide even more, like, extra protection within the sunscreen.
Okay, so all right, so we already answered that question. Let's say you forgot to put on that sunscreen, or maybe you didn't put on enough, and you end up with a sunburn. What are some treatment options for people who get a sunburn?
Really, it's just the symptomatic treatment, depending on the severity of the sunburn too, to prevent complications from the sunburn. Because if you're blistering or things like that, you can actually become very dehydrated very, very quickly, because you'll actually lose quite a bit of fluid through the skin because you've disrupted that barrier. And so making sure you stay very well hydrated, anti-inflammatories, ibuprofen, Aleve, things like that over the counter can help with some of the pain, swelling, and redness. And then making sure you're using moisturizers that contain aloe and as few scents as possible, preferably unscented. That's not going to be irritating to the skin. Cool baths and showers, cold compresses, things like that, just for symptomatic relief is really all you can do.
All right, that's great.
If unable to take, or like if somebody's unable to take oral anti-inflammatories, so somebody that's like on blood thinners or has a history of ulcers or something like that, they can also do topical anti-inflammatories. There's a topical diclofenac, I think the brand name is Voltaren, that you can get over the counter now as well. That can kind of supplement all of the conservative stuff.
Okay, so that's great. So people can look out for that one. So. All right, so moving on to a different kind of burn. So again, since we're doing summer activities and we're out, maybe around the campfire a little bit more, or just a fire in our backyard, or even fireworks coming up with the 4th of July later. You can also, in addition to sunburns, you can get maybe first, second, and third degree burns. Can you walk us through the different types?
And you can actually get first, second, and third degree sunburns as well, along with just regular like thermal burns. So first degree burns is only going to be fairly superficial. It can have a little bit of swelling, and it gets red, but no blisters are present. The second degree burns, you can have some blisters with some thickening of the skin and then redness, and it's still pretty painful. Third degree burns will generally turn more waxy and white in color, and the skin gets very raised and kind of leathery in texture. Third degree burns generally don't hurt because you've actually damaged the nerves. So they don't hurt nearly as much. Now the surrounding areas that might still have second degree burns will still cause quite a bit of discomfort, but the actual third degree burn areas generally won't hurt as much, but have a significant risk of infection and dehydration.
Okay, so all righty. Okay, so on to a different type of common skin condition. I think probably most people have had this. So can you talk, what is acne and what causes acne or pimples? I know it goes by a lot of different names.
So acne, there's a lot of different types of acne as well. And I mean, I won't get into the different types because you essentially, like, there's different treatments for each one of them. But basically oil glands, hair follicles, things like that become clogged in the skin. And then you get the buildup of the sebaceous material that the skin normally produces, and dead skin cells and whatnot. And then they become acutely inflamed, and that leads to your more painful pimples or comedones, blackheads, things like that. And so some people are more genetically disposed to this. Some people just get that by rotten luck in general. It just varies person.
Okay, so that's great. So, Okay. And then as far as treating acne, what are your recommendations for that? And then also, can acne be prevented?
So the number one thing is don't overtreat. If you overtreat, you can actually make your acne worse. So if you are one of those people who like can't stand the acne, and then you start washing multiple times per day, like 3 to 4 times a day, that's way too much, because then you actually end up making the glands in your skin overactive and responding to the overdrying of the skin, and then that leads actually to worsening acne. Another thing that people need to remember is that your skin is multiple layers thick. So anything that like everything goes from the bottom up. So any treatment that you do for preventing acne is going to take several weeks before you're going to notice any difference whatsoever, because any lesions that are already there that you can't see yet still have to make their way to the surface. And so it's going to seem like a treatment's not working for at minimum 4 weeks before you're going to notice any improvement. And so I always make sure and tell my patients, like, don't get discouraged if it's not working, give it time. And
Okay.
so far, most patients have been extremely happy with the management options that we've done, because we've been able to keep everything fairly conservative with minimal side effects.
Okay.
But there's
Great.
a lot of different over-the-counter stuff. There's a lot of different medications. So I generally will, most patients have already tried over-the-counter stuff by the time they get to me, to discuss different medical options. Benzoyl peroxide is usually the most common starting point. You can get those over the counter. They come in foams, lotions, you name it, all different types of formulations. Usually that's going to be 1 to 2 times per day. You have to be careful with it because it can bleach pillowcases and clothing. Retinoids are also used for topical. Those can be used for mild to moderate acne. And then just making sure, depending on the type of acne that you have, if you've got more dry skin, that then causes lesions that way because of the inflammation from the dryness, you want to make sure you're moisturizing. But if you've got really oily skin that's causing the issues, then you want to make sure you use something that's more drying.
Okay. All right. That makes a lot of sense. So thank you.
Makeup will also increase your risk of acne. So making sure that you take makeup off every day, don't sleep in it, things like that.
Okay. So, all right. Good to know. All right. On to another type of skin condition, eczema. Can you define what is eczema and what causes it?
So eczema is a specific type of what's called atopic dermatitis. It is essentially an autoimmune and like intrinsic, like your body's attacking the skin. It causes an inflammation of the skin. Usually that's brought on by, it's called the scratch that itches. So if somebody would go and scratch their skin, then they actually will develop the rash after they scratch the skin. But then it gets progressively more itchy. And so then they continue to scratch and that rash continues to get worse. Usually that's going to be on the extensor surfaces. It'll be on the flexor surfaces of the arms and legs. So inside the elbow, on the backside of the knees, and then also on pretty much all over the hands are the more common places.
Okay. And then the treatment options. How can eczema be treated?
It depends on the severity and the location, because you have to be careful with like eczema on the face, because you can't use high potency steroid creams on the face because it's a little bit thinner skin, and high potency steroids used repetitively can actually thin the skin. So there's only a handful of options that are actually safe for the face, as well as the genitals and like the ears and stuff like that. But then once you get to like arms, legs, hands, there's a whole slew of options that you can use both topically and orally. Now they've even got biologic medications that you can do for eczema if your eczema is bad enough, where you do injections every couple of weeks, every month, every couple of months, and it varies by patient.
Okay, that's great. All right, so moving right along to our next question. Now we're switching gears to psoriasis. So can you explain what is psoriasis, what causes this, and can it be treated?
So psoriasis, again, is another autoimmune skin condition. You actually get large plaques that almost have like a silvery texture to them, to the top of them. So they'll almost be like white with very red surrounding areas. and they're significantly raised off of the skin. Usually these are on the extensor surfaces, so the backs of the elbows, the fronts of the knees, but it can be head to toe as well. There are multiple different types of psoriasis. There's some types that are just on like the palms and the soles of the feet. There's some that are something like it's called guttate psoriasis that are just small little lesions that none of them are larger than a quarter. But then there's regular plaque psoriasis where the plaques can be as large as the entire back. And so it just varies person to person again. You actually treat them fairly similarly to eczema with topical steroids, depending on the body or body surface area, where they're located, how much percentage of the body is covered. Will also depend on the treatment that is warranted based on, do we want to do a systemic medication or do we want to do just like topical medications?
Okay, that's great. All right. Another skin condition that people may be interested to hear about is chronic dry skin. What are your recommendations for that?
So chronic dry skin is called xerosis is the medical term, and it's XERSOSIS. XEROSIS. There you go. And so it can be caused by any number of things, and it can just be what's called idiopathic, meaning we don't have an underlying cause. So being dehydrated in and of itself is probably one of the biggest common causes of xerosis, because we're all so busy in our work lives that a lot of us will just go without drinking like we should. Or most people around here anyway are more interested in drinking soda, sweet tea, things like that are actually dehydrating. But then there's also underlying health conditions like hypothyroidism, diabetes, things like that can actually make you more dehydrated, as well as medications that then just make your skin overly dry, which then becomes very itchy as well. So really the main thing is either treat the underlying conditions or just making sure that you're using really good moisturizers, making sure you're staying hydrated, and then just symptomatic control for the itching. So ideally, we wouldn't want to really use the topical steroids for that because again, those don't come without side effects of like the skin thinning, but they can also, you can just do topical emollients to hold moisture in, like Aquaphor, Vaseline, things like that right after bathing will actually help with the moisturizing the skin.
Okay. All right, thanks. All right. So again, another skin condition we wanted to cover here during this Zoom meeting was rosacea. What is it? What causes rosacea, and how is it treated?
So rosacea is very common. Usually it's going to affect predominantly on the cheeks. So it'll be like right through here, this area. I don't know if you guys can see the video of me or not. It'll be right through this area, and can also extend up to the forehead and above the nose, and even on the nose. You can actually get a subcomponent of rosacea called rhinophyma, where the nose will start to get bigger and more inflamed as well. But it is actually treatable just with topical medications. Sometimes we'll have to go to the extent to see a facial specialist to actually get some debridement of some of the thickened skin. They can have, like, the flare-ups from it can last weeks to months at a time, but it is very treatable with both topical antibiotics, topical anti-inflammatories, and then oral forms of all of that as well.
Okay, that's great. Thanks. All right, this next question is kind of near to me. I was actually just weeding the other day at our house, and I ran across some poison ivy, and I think I've gotten pretty good at identifying it, so I try to stay away from it because I do get a bad reaction from it. So, but for those of us who are allergic to poison ivy, poison oak, poison sumac, and our skin does accidentally touch those plants, what can we do?
You want to thoroughly rinse it off as quickly as you can, ideally within 30 minutes, before you start to have a reaction to it, if you know you came in contact. And ideally, you want to use cold water to do that, because warm water will actually just increase a histamine response, which then worsens itching and makes things exponentially worse. Once you actually have the lesions, if you've already washed off the oils and you develop the rash still and everything else, that rash isn't going to spread based on you scratching at it, things like that. Like it's already there. What's there is there. So and the oil has already been washed off of your body. You're not going to spread it on yourself just by scratching at the rash. But the biggest thing is to still not scratch, because you can actually cause infection as well. And that's super easy to do whenever you've already developed blisters from the rash itself.
Okay. So, wait, if it gets bad, like well, I guess I would ask, like, when would you maybe see a doctor if it got bad enough? I mean, what would be like some signs or symptoms that maybe I should go check this out?
So if you get a large enough surface area on your body that you're not really able to keep up with it and it's just making you miserable, then definitely see your provider for it. Over-the-counter stuff, you can use the calamine for symptomatic relief. You can use hydrocortisone 3 to 4 times a day, minus the genitals and the face. Hydrocortisone can be used in a limited amount on the face and genitals, but that needs to be at recommendations of your medical provider. But then anything over that, like after that, really anything else over the counter, sometimes topical Benadryl cream will work, or at least help some with symptoms. But if you have any poison ivy around your eyes, around your mouth, you need to see a provider immediately. Any trouble breathing, trouble swallowing, eyes swelling shut, things like that. I've seen people who just, like, whenever they were burning brush, they burnt poison ivy and vines and didn't realize it. And so they actually inhaled it. So it got down into their airways that were excessively allergic to it. So that they actually ended up in the hospital with a breathing tube because of it. Like it can be pretty bad in those kind of situations. So just making sure you're avoiding exposure if you've got that bad of a reaction to it. And then making sure you're rinsing it off as quickly as possible if you did come in contact.
Yeah, that's great advice. So. All right. So now that we've talked about maybe some of the things that can go wrong with our skin, what are just some general healthy tips to keep our skin healthy and just good looking?
So making sure, one, I recommend getting a yearly skin check, whether you are pale skinned or darker skinned. Having a skin check at your yearly wellness exam is super important. It's probably the most forgotten aspect of your health that people forget to ask about. Actually make it a point during all of my patients' visits if they have any skin lesions or any spots that they are concerned about, because that's usually the first thing from their mind whenever they come in to see me. And so making sure that you're being more proactive instead of reactive and trying to find abnormal skin lesions before they become too abnormal. And then making sure you're staying well hydrated. And if you get any cuts or anything like that in your skin, just make sure you know about them so you can keep them clean and to where they're not going to get infected. Wear sunscreen is probably the number one thing that can help with your skin more than anything. And then just avoid, like, trying to reduce the amount of UV exposure.
Okay. Well, as you said at the beginning, it's our largest organ, so we really need to take care of it. So.
And then taking a multivitamin once a day too. I mean, it doesn't hurt anything. It can only help. So.
That's great. So, all right. I think this is our last question. So, if you do have a skin condition that maybe concerns you, should someone go to their primary healthcare provider? Do they need to see a dermatologist? What is your recommendation?
It depends on the provider. So some primary care providers like myself are extremely comfortable with dermatology. I have extra training in dermatology in my residency program. We had a dermatology clinic literally right next to our primary care clinics. And so I got extra training in all of the dermatology procedures, minus a couple of them that are specifically done in dermatology residencies. But some primary care providers will do minor dermatologic procedures, so like biopsies and shave biopsies and things like that, whereas others aren't as comfortable with that kind of training, and so they didn't do nearly as much of it in their residency programs. And so you might need to see a dermatologist for that aspect too. But then there's things like I even do like lipomas and cysts and stuff like that in my office as well. So it's one of those things, like, it's just different for every provider. So the best thing you can do is to bring your concerns to your primary care provider. You can send pictures to them on my chart of various skin lesions and see if it's something that they would be willing to look at, or if you need to see a dermatologist, or have them refer over to a different clinic that might actually address it or be able to address it. That's even here at Phelps. So I have a number of colleagues who send me patients for dermatologic conditions. So it just varies by provider.
Okay, that's great. Okay, so we are going to put up a polling question here, and I'm going to launch this here, and well, or maybe not. So
there it is.
There it is. Okay. So I'll leave that up here for a couple minutes, and you guys are welcome to put in your answers there. And then in the meantime, if you guys do think of any other questions, we have a couple minutes left. We can get to those questions after there. So. Okay, so it looks like most likely or very likely is how you would recommend the Scope podcast. So we love hearing that. So I'm going to stop sharing those. So yeah, like I said, we'll open it up to any other questions if you guys have here. But if we don't get any questions, we'll go ahead and end this and give you guys some time back. So I'm not seeing any questions come through.
There weren't any more on Facebook, correct?
Yeah. Yes. I think we just had that one. So
okay.
Yeah. So well, if there's no other questions, we'll go ahead and wrap this up. So thanks so much, everyone, for tuning in to the Scope at Night, and a huge thank you to Dr. Offutt for joining us tonight. We appreciate all the insight you've been able to share with our community, as always. So thanks for being here.
Thanks for having me.
As a reminder, the show has been recorded and will be emailed to participants. It can also be rewatched on our Facebook page and shared with any family and friends who may have missed the show. If you like this show and would like to know more, check out our other episodes of the Scope on YouTube or visit phelpshealth.org. All right. Have a great evening, everyone. Thanks.